Welcome to Healthy Aging 60 Plus, where we share vital health secrets. Today, we discuss a life-saving technique for stroke emergencies. Imagine a quiet afternoon turning into a nightmare. A stroke strikes suddenly, leaving you helpless and terrified about what comes next. A stroke happens when blood flow to a part of your brain is cut off. It is a terrifying medical emergency. Every single second counts because brain cells start to die without oxygen. Immediate action is the only way to prevent damage. Before we learn the technique, remember this rule: always call emergency services immediately. Professional help is your best chance of survival. However, the moments while waiting for the ambulance are critical. This 3-minute technique can help stabilize the patient before help arrives. To understand why this technique works, we must first understand what happens inside the brain during those first few critical minutes. There are two main types of stroke: ischemic, caused by clots, and hemorrhagic, caused by bleeding. Both require immediate medical attention. When oxygen is cut off, brain cells begin to die within minutes. This is why quick recognition of symptoms is essential. The most common warning sign is a drooping face. Ask the person to smile and see if one side droops down. Check for arm weakness by asking them to raise both arms. If one arm drifts downward, it is a warning sign. Speech difficulty is another major indicator. If their speech is slurred or strange, you must act quickly to save their life. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services immediately without delay. Once you have called for help, do not just stand there. The next 3 minutes are vital for the patient's recovery. The very first step of our technique is for you, the helper, to stay absolutely calm. Panic will only worsen the situation. If the patient sees you panicking, their blood pressure will spike. Keeping them calm is the first step to saving them. Gently help the person into a safe position. Do not let them fall, as head trauma can be fatal during strokes. Position them lying down with their head slightly elevated. This uses gravity to help reduce intracranial pressure inside the brain. Immediately loosen any tight clothing, especially around the neck and chest. This ensures their airway remains open for better breathing. Ensure the patient has plenty of fresh air. Open windows, if necessary, to maximize oxygen availability for their struggling brain cells. Oxygen is the fuel the brain desperately needs right now. Every breath counts in preserving the brain tissue from permanent damage. Speak to them in a soft, reassuring voice. Tell them help is on the way. Reassurance lowers stress and blood pressure. Lowering stress hormones is crucial. High stress causes blood vessels to constrict, which is dangerous when blood flow is already compromised. Guide them to take slow, deep breaths. Inhale deeply through the nose and exhale slowly through the mouth to stabilize rhythm. Breathe with them. Mirroring your calm breathing helps the patient synchronize their own breath, preventing hyperventilation and further panic. You can gently massage their hands or fingers to promote circulation. This simple touch also provides a strong psychological comfort. This physical contact stimulates the parasympathetic nervous system, which helps the body relax and reduces the strain on the heart. While performing these calming techniques, keep checking the time. Note exactly when the symptoms started to tell the medical team. Knowing the exact onset time is critical for doctors. It determines if they can administer clot-busting drugs effectively. Certain treatments are only safe within a specific time window. Your accurate report can be the key to their recovery. Now, let us discuss what you must absolutely not do. These common mistakes can be fatal for a stroke victim. Never give them food or water. Stroke often impairs swallowing, and they could choke, causing aspiration pneumonia or blocking the airway. Aspiration is a severe complication. Even a small sip of water can enter the lungs and cause a deadly infection. Do not give them aspirin or any medication. If the stroke is caused by bleeding, blood thinners will make it worse. You cannot know the type of stroke without a CT scan. Giving the wrong medication can turn a stroke fatal instantly. Do not let them sleep, and do not drive them yourself. Paramedics can start life-saving treatment on the way to the hospital. Ambulances are equipped to handle complications like seizures or cardiac arrest. A private car is not a safe place for stroke victims. Keep the patient at a comfortable temperature. If they are cold, cover them lightly, but do not overheat them. If the person becomes unconscious but is still breathing, place them in the recovery position on their side to keep airways open. This position prevents the tongue from blocking the throat and allows any fluids to drain safely from the mouth. Monitor their breathing continuously. If they stop breathing at any point, you must be prepared to start CPR immediately. CPR is only necessary if there is no breathing or pulse. Otherwise, stick to the calm positioning technique we discussed. When the ambulance arrives, stay out of the way but provide all information: symptoms, time of onset, and any medications taken. Hand over the care to the professionals. Your job of stabilizing and comforting the patient has given them a fighting chance. Now that we have covered the emergency response, let us talk about prevention. The best cure for a stroke is preventing it. Lifestyle changes can significantly reduce your risk. Regular moderate exercise keeps your blood vessels flexible and your heart strong. A balanced diet rich in fruits, vegetables, and whole grains helps maintain healthy blood pressure and cholesterol levels. High blood pressure is the silent killer. Monitor your blood pressure regularly and take medication as prescribed by your doctor. Smoking damages blood vessels and doubles your risk of stroke. Quitting is the single most important step for your health. Limit alcohol consumption. Excessive drinking raises blood pressure and can trigger irregular heartbeats, increasing stroke risk significantly. Conditions like atrial fibrillation can cause clots to form in the heart. Regular checkups can detect these hidden dangers. Stress management is also key. Chronic stress keeps your blood pressure high. Find activities that bring you peace and joy. Quality sleep allows your brain to clear out toxins. Aim for 7 to 8 hours of restful sleep every night. Maintaining a healthy weight reduces the strain on your circulatory system. Even a small weight loss can make a difference. Stay hydrated. Thick, dehydrated blood is more likely to clot. Drink plenty of water throughout the day for circulation. Remember, preventing a stroke means more years with your loved ones. Your health is a gift to your family. Let's recap the 3-minute technique. Call emergency immediately, keep them calm, position them safely, and encourage deep, slow breathing. This knowledge gives you the power to act instead of freezing in fear. You can be the difference between life and death. Please share this video with your friends and family. Stroke can happen to anyone, and everyone should know these steps. If you found this information valuable, please subscribe to Healthy Aging 60+. We are dedicated to your long-term wellness. Start taking care of your brain health today. Small changes in your daily routine can build a shield against stroke. Your brain is your most precious asset. Protect it with knowledge, healthy habits, and the readiness to act in emergencies. Always consult with your healthcare provider before making major lifestyle changes. They can guide you based on your specific needs. Life is a beautiful journey. We want you to enjoy every moment of it with strength, clarity, and good health. Survivors often say that the quick actions of a bystander saved their quality of life. Be that hero for someone. Do not let fear rule you. Preparation is the antidote to fear. Now you are prepared to handle a stroke emergency. Practice the FASD check in your mind. Visualize what you would do. Mental rehearsal makes actual response much faster. Check your phone now. You have emergency numbers saved. Make sure they are accessible with just one single touch. We hope this video brings you peace of mind. Knowing what to do empowers you to protect the people you love. Thank you for spending your time with us today. Your commitment to learning health safety is truly commendable and inspiring. Check out our other videos on heart health and nutrition. We have a library of resources to support your aging journey. Your heart and brain work together. Keeping one healthy helps the other. It is a holistic approach to aging well. We upload new content every week. Join our community and let us navigate the path of healthy aging together. Remember the 3 pillars. Recognize the signs, call for help immediately, and reassure the patient while waiting for the ambulance. With the right knowledge, even a scary situation like a stroke can be managed. Stay calm, stay informed, stay safe. Caregiving is an act of love. Being prepared is the highest form of caring. You are doing a great job. Knowledge is indeed power. Today, you have added a powerful tool to your kit for protecting your family's health. Leave a comment below if you have any questions or want to share your own experiences. We love hearing from you. Don't forget to like this video to help the algorithm spread this life-saving information to more people who need it. As we conclude, take a moment to appreciate your health. It is the foundation of all your dreams and happiness. You have the strength to handle emergencies. Trust your instincts, use your knowledge, and always prioritize professional medical assistance. This has been a presentation by Healthy Aging 60+. We are honored to be a part of your health journey. Disclaimer: this content is for educational purposes only. Always seek the advice of your physician or qualified health provider. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. If you think you may have a medical emergency, call your doctor or emergency services immediately. Safety always comes first. Thank you for watching and for reading our disclaimer. We want to ensure you are safe and well-informed at all times. Stay tuned for our next video where we will uncover more secrets to living a long, happy, and healthy life. Until next time, take care of yourself and each other. Wishing you health and happiness from Healthy Aging 60+. Click the video on the screen now to continue learning. There is so much more to discover about your health. Goodbye for now. See you in the next video. Stay healthy, stay active, and keep aging gracefully with us.